Welcome to Med Updates Network. Ceftriaxone explained. The strong antibiotic you need to know. How does ceftriaxone work? And why you shouldn't be scared of the needle. Have you ever been to the hospital with a high fever, pneumonia, or a nasty infection, and suddenly the doctor orders a shot or enforce something called ceftriaxone? Maybe you've seen the misspelling online, Ceftriaxone with a C. Today, we're breaking down one of the most powerful and widely used antibiotics in modern medicine. By the end of this video, you'll know exactly how it works, what it treats, and why doctors call it a heavy hitter. What is it and how does it work? Ceftriaxone belongs to a class of antibiotics called cephalosporins, third generation. Think of it as the upgraded, stronger cousin of penicillin. Here's the cool science. Bacteria have a protective outer shell called the cell wall. Ceftriaxone works by preventing the bacteria from building this wall. Imagine trying to build a brick house, but someone keeps stealing your cement. Without a wall, the bacteria burst and die. Unlike pills you take for a week, ceftriaxone is usually given as an injection or foredrip because your stomach acid would destroy it. That's why you'll only get this at a clinic or hospital. What does it treat? Brain meningitis, lungs pneumonia, tooth abscesses, ear infections, severe cases, bone infections, kiss mark gonorrhea, STD treatment. This antibiotic is a broad-spectrum weapon, meaning it attacks many different types of bacteria. But here are the top 5 reasons you'd get it. 1. Community-acquired pneumonia, especially if you're sick enough to be admitted. 2. Meningitis. It crosses the blood-brain barrier, which most antibiotics can't do. 3. Lyme disease, late stages. 4. Typhoid fever. 5. And famously, gonorrhea. In fact, the CDC currently recommends a ceftriaxone shot plus an oral antibiotic as the standard treatment. Important reminder, it does nothing for the common cold or flu. Those are viruses, side effects, and allergies. Like all strong medications, ceftriaxone has side effects. Most are mild, pain at the injection site, diarrhea, or nausea. But there is one life-saving rule you must remember. Do not mix ceftriaxone with calcium, like in 4 fluids or TPN nutrition. In the body, this creates dangerous crystals that can damage the lungs and kidneys. This is a major safety protocol for nurses. Also, if you have a severe penicillin allergy, you might be allergic to ceftriaxone too, about 10% cross-reactivity. Tell your doctor immediately if you get hives, swelling, or trouble breathing. Why you should care: antibiotic resistance. Ceftriaxone is incredible, but we are losing it. Bacteria are fighting back. We call this antibiotic resistance. We already have super gonorrhea strains that are harder to kill. If we overuse ceftriaxone or use it when it's not needed, we create super bugs that no drug can stop. So, when your doctor says you don't need antibiotics for your green mucus, they're not being cheap. They're saving ceftriaxone for the day you really, truly need it. Quick recap. Ceftriaxone is a strong, injectable antibiotic for serious bacterial infections like pneumonia, meningitis, and gonorrhea. It kills bacteria by breaking their walls. But it has risks, especially with calcium, and we must use it wisely to prevent resistance. Got a question? Drop it in the comments. Stay healthy, and see you in the next one.